Hi, I am Kaitlin and today I will be talking to you about sexual arousal disorders. In this video, I will discuss the physical and psychological causes of female sexual arousal disorder and male erectile disorder. Also, the dysfunctions of it and treatment options for both disorders. According to Cindy Meston and Amelia M. Stanton, female sexual arousal disorder is defined in the DSM-5 as a lack of or reduced sexual interest. In order to be diagnosed with this disorder, they must have 3 of the following 6 symptoms: absent or reduced sexual interest, sexual thoughts or fantasies, sexual excitement or pleasure, sexual interest in response to internal or external sexual cues, genital or non-genital sensations during sexual activity, and no or reduced sexual initiation. There can be many different causes to female sexual arousal disorder. I will discuss some of the many physical and psychological causes. First, I will discuss psychological causes. Anxiety, depression, and ongoing stress may all suppress sexual desires. A history of sexual abuse or unwanted experiences may cause fear for sexual intimacy. Meston says women who experience sexual abuse are more likely to avoid sexual interactions with their partner and are less likely to be receptive of sexual cues from partners. Feelings about one's body can affect the way they feel about sexual activities, as well as feelings of desire and acceptance by their partner. A woman's religion or culture can play a role in sexual arousal. If they believe that being interested or engaging in sex is shameful, they will experience guilt and shame during sex, which leads to low sexual desire or arousal. During menopause, a woman's estrogen levels decrease, which has been linked to lower sex drive. A decreased sex drive can be due to a chemical suppression of those ovarian hormones. Some other physical effects may be major illnesses like cancer, heart disease, or diabetes, and medications like antidepressants. As I mentioned before, some dysfunctions of this disorder are a lack of sexual interest or willingness to be sexual. Also, being unable to become aroused or remain aroused during sexual activities. Non-medical treatment may include therapy to address mental health issues, communicating with your partner about sexual satisfaction, using a lubricant if you can't naturally, or maybe introduce a device to enhance clitoris stimulation. A medical treatment option may be estrogen therapy. This can increase vaginal blood flow and help enhance lubrication in the vagina. Flibanserin is a daily pill that can help boost a woman's sex drive for those who have a low sexual desire. There can be many different causes for this dysfunction, so finding the right treatment for you may take time, and causes may be overlapping as well. Next, I will be talking about male erectile disorder. Male arousal involves the brain, hormones, emotions, nerves, muscles, and blood vessels. Male erectile disorder can be a result of a problem with one of those. Male erectile disorder is when they are unable to get and keep an erection firm enough for sex. Although some men may time to time experience difficulty with an erection, to have male erectile disorder, it must be persistent or happen on a number of occasions for some time. According to Viagra.com, erectile disorder affects about 30 million men in America. On the right is a photo of a flaccid and erect penis and the main muscle involved in an erection, the corpus cavernosum. There are many different factors that can cause male erectile disorder. I'll discuss a few physical and psychological causes. Most cases of erectile disorder are caused by physical factors, but psychological issues can worsen it. Since emotions are an important part in achieving an erection, things like depression, anxiety, or other mental health issues can cause a male to have trouble getting or keeping an erection. Proper blood flow is one of the main things needed to keep and get an erection, since that is what happens with one. There can be some physical causes impairing proper blood flow, including heart disease, atherosclerosis, which is clogged blood vessels, or obesity. All of these may have a direct impact on blood flow to the penis, causing male erectile disorder. It is important to know that there may be an overlap of physical and psychological factors. For example, someone who is obese may not have good blood flow to the penis, affecting his ability of an erection, but low self-esteem may also impact erectile dysfunction. Some dysfunctions of male erectile disorder are trouble getting and keeping an erection, and also a reduced sexual desire. Since there are so many causes, there are many different treatment options for male erectile disorder. If they are experiencing mental issues like depression or anxiety, therapy is recommended. They can help teach you how to lower anxiety or stress levels. Lifestyle changes are encouraged for those who are smokers, have diabetes, or are overweight. It is suggested that you either quit smoking, drinking, or drug use, and increase physical activity. Viagra is a medication used to relax the smooth muscles and increase blood flow to the penis before sexual intercourse to cause and keep an erection. However, the medication only works if you are sexually stimulated. Surgery is the last resort, but may be needed if you have damaged arteries. They may need to rebuild blood vessels to increase blood flow to the penis. I hope you enjoyed this educational video about 2 sexual arousal disorders that men and women develop. Here are the sources where I found my information. Thank you for watching.